Hello friends, today we will learn what sciatica is as well as the causes that produce it. To start talking about sciatica, it must be clear that sciatica is a symptom of an underlying medical condition. It is not a medical diagnosis in itself, which means that it is a set of symptoms associated with different pathologies or origins, since depending on its origin, we will decide one type of treatment or another. Symptoms can appear in the lumbar area, in the buttock, along the entire back of the leg, and even on the sole of the foot. Among the most common symptoms is pain, which can sometimes be disabling. In addition, there may be numbness, muscle weakness, tingling, burning sensation. It is usually a unilateral condition, as it is felt only on one side of the body. The pathologies or causes that can trigger sciatica symptoms are the following: nerve compression, piriformis syndrome, and inflammation of the sacroiliac joint. The lumbar region is made up of 5 lumbar vertebrae. On each side of the vertebrae, we have a nerve root that comes from the spinal cord. For each vertebral level, we have 2 roots, one that goes to the right and one to the left. The sciatic nerve is formed by the branches 4, L4, L5, S1, S2, and sometimes S3. It is the longest and thickest nerve in the entire body. It starts from the lumbar area and runs down the entire back of the leg to the sole of the foot. It is responsible for the motor skills and sensitivity of the entire back of the leg. The first cause of sciatic pain can be nerve compression. Between each of the vertebrae there is an intervertebral disc. If this disc herniates or if it has a protrusion, it can compress one of the nerve roots, giving the symptoms of sciatica. Depending on the root and nerve level, we will have different symptoms. For more information about hernias, you can click on the link that appears on the screen. The Piriformis syndrome refers to a muscle that is located on the back of the pelvis, originating from the sacrum and the major sacroiliac ligament and inserting into the greater trochanter of the femur. Sometimes irritation of this muscle can cause pain in the back of the leg without any associated disc problem or disc herniation. Common in long-distance runners. Also, in 15% of the population, the sciatic nerve passes through the piriformis, so if this muscle is tense or contracted, it can cause compression of the sciatic nerve, giving the common symptoms of sciatica. As the last of the most common origins, we have the sacroiliac joint, a joint formed between the sacrum and the ilium, which, when inflamed or hypomobile, can cause pain that corresponds with the characteristics of sciatic pain. Thank you for watching our videos. If you liked it, click like or subscribe to the channel. You can also follow us on the following social networks. If you know someone who needs this therapy, share the video with them.